Welcome everyone. Welcome to the final part of most anticipated MCQ series for our NEET PG 2024 candidate. Right. So we have already had two parts of this session, part one and part two, in which we have discussed uh, questions from various topics of forensic medicine, and this is the final concluding part. So let's begin by taking the first question of this series. A doctor is teaching his juniors about competitive inhibition of cholinesterase enzyme and states that there are compounds which spontaneously hydrolyze away from the enzyme after 24 to 48 hours, and thus in its toxicity there is no need to give oxime reactivator therapy. What is the example of such compound? These kind of questions around agricultural poisons or organophosphorus poisons or similar compounds which has the mechanism of action, that is inhibition of cholinesterase enzyme, is very common. So first thing I'm going to write here on the top is very common asked type of questions. So these kind of questions are very commonly asked in the exam. The questions around organophosphorus or agricultural poisoning. Now, in this question, what exactly is being asked is what are the form of agricultural poisons which competitively inhibit cholinesterase enzyme, but they hydrolyze away in 24 to 48 hours, right? So these compounds which hydrolyze away compounds that hydrolyze away are carbamates, right? Carbamates are the compounds that hydrolyze away from the enzyme by themselves, that is spontaneous hydrolysis away from the enzyme, whereas those compounds which does not hydrolyze away are the organophosphorus compound, right? And thus in organophosphorus treatment we need oxime reactivators, right? Like pralidoxime or diacetyl monoamine, PAM DAM, which are commonly called as pralidoxime and diacetyl monoamine. So out of the four choices, which are malathion, diazinon, propoxer, and parathion, we need to identify a compound which is not an organophosphorus compound, rather it is a carbamate compound, and that compound is propoxer, right? Malathion is organophosphorus, triazinon is organophosphorus, and parathion is organophosphorus. Diazinon and parathion, both of them are aryl phosphates. Okay, so both are organophosphorus and aryl. Whereas malathion is alkyl phosphate. In their toxicity, oxime reactivators will be needed, right? So our correct answer is propoxer. Uh, let's have few words about organophosphorus intoxication. We all know Mechanism of action is very simple. It is irreversible inhibition of cholinesterase enzyme. The specific antidote is atropine, right? Uh, Oxime reactivators are needed in treatment, right? And we all know how to recognize their toxicity. It is primarily given by their muscarinic symptoms, which are given by the mnemonic sludge, right? Sludge means increase uh, water in the body or from the body. So you will see S for salivation, L for lacrimation, U for urination, D for diarrhea, G for increased GI motility, and E for MSS. So if you ever encounter a question where there are a lot of secretions in the body or from the body, particularly the victim is from the background of agriculture or farming, consider organophosphorus toxicity. Let's move to our next question. A person who removes stains with bleach. So it is given somebody who removes stains with bleach in a factory land up in hospital with a history of accidental consumption of some crystals. He has bitter taste in mouth, pain abdomen, and coffee ground vomitus. So important clinchers in the questions are bitter taste in mouth. Now, bitter taste in mouth can be due to consumption of lot of products. So it's not a very big clincher. Pain abdomen, yes, any foreign product which goes into abdomen can lead to pain abdomen. It's a very generalized symptom. But coffee ground vomitus, this is an important finding. Further, it is given that on investigation, his blood calcium levels are low. So calcium levels are low, which means this person is manifesting hypocalcemia. Hypocalcemia. What is the compound? So answer is very simple. See, these kind of questions again come in the examinations quite frequently, and generally in these kind of questions some kind of working background is given. So what is the working background given in the question is he is a worker who removes stains with bleach. Okay, so this working background is very important, right? And what does he consume? He consumes certain crystals. Okay, so what, let's see what are the options. One is carbolic acid, second is zinc phosphide, third is oxalic acid, and fourth is potassium hydroxide. Now, two things which come in crystal format out of the four compounds which are given are oxalic acid and potassium hydroxide. both of them do come in crystal format. But then, what is the compound which would be responsible for coffee ground vomitus and hypocalcemia? That compound is oxalic acid. Oxalic acid in body is converted to oxalate crystals, and these oxalates, they combine with calcium in blood to precipitate as calcium oxalate stones in kidney. So in oxalic acid toxicity, we tend to get calcium oxalate stones in kidney also, and simultaneously, because they are combining with the calcium which is present in the blood, they would lead to they would automatically lead to hypocalcemia, right? They would lead to production of hypocalcemia. Okay, so that's how the choice of answer becomes easy once you understand the oxalate metabolism in the body. Uh, let's take this time to talk about very important acid or corrosive, that is carbolic acid, because carbolic acid is slightly different in its manifestations in the body. See, one thing with carbolic acid that we need to understand is a concept called as carboluria. Carboluria. Carboluria is green color urine in carbolic acid toxicity. So green color urine in carbolic acid toxicity is the condition is called as carbolic urine. Another thing that we need to understand in carbolic acid toxicity, which is quite different from other corrosives, is that in carbolic acid toxicity, the stomach mucosa is thickened. It is not thinning. So normal process of corrosion in the GIT is thinning of stomach mucosa, but in carbolic acid intoxication the stomach mucosa is thickened. Traditionally, this kind of stomach is called as leathery stomach, and because the stomach mucosa is thickened, having a leathery appearance, in carbolic acid toxicity, we can do something which is generally contraindicated in the treatment of corrosive, and that is attempting gastric lavage, because there is thickening of stomach wall. So, performing gastric lavage should not be a contraindication, and so we say gastric lavage can be performed. Okay, so we should remember these three very important things regarding carbolic acid. Let's move on and let's take our next question. Our next question is, a 24-year male is arrested by police with complaint of eve teasing females in a mall. He seems to have consumed alcohol. His examination reveals congested eyes. So we have examination findings as congested eyes, which goes in favor of alcohol consumption. Rapid pulse, again, yes, uh, It's also a sign of alcoholic consumption. When a person is agitated, he is asked to walk in a line which he cannot. So he is not able to walk in a line, which means uh, he fails one of the tests which is performed for alcoholic consumption, right? And his blood sugar, alcohol level is 140 milligram percent. So eventually the question actually tells us this thing also, that he has actually consumed alcohol and the blood alcohol level is 140 milligram percent. The doctor will prepare what report. So the question is not about whether he has consumed alcohol or not. The question is all about what kind of report will be prepared by the doctor. Okay, let's see the options. One option is he has consumed alcohol and intoxicated, or he has consumed alcohol and under the influence. Third option is consumed alcohol and in stupor. And fourth is drinking. Okay, there are four options given. Remember, whenever we talk about alcohol examination, right, there are two things to consider. One is whether he has consumed alcohol, and second is not consumed alcohol. So the first thing that a doctor after examination will decide is whether the person has consumed alcohol or whether the person has not consumed alcohol. Okay. Second thing is, if the person has consumed alcohol, then if yes, then what stage of consumption? What stage of consumption? So basically, the question is asking about when a doctor is going to prepare the report, what is the stage of consumption he is going to write in the report. Okay, and to understand the stage of consumption, we need to understand these different stages of blood alcohol level. So if the person has blood alcohol level below 10 milligram percent, he is stated as sober. So consumed alcohol but sober. 10 to 80, drinking, right? 80 to 150 milligram percent, under the influence of alcohol. 150 to 300, drunk or intoxicated. 300 to 400, stuporous, and more than 400 in coma, right? So these are different stages of alcohol reporting. Remember, for the examination purposes, if we want to say that which stage would be very important, so these initial four stages are very important to remember. Less than 10, sober. 10 to 80, drinking. 80 to 150, under the influence. And 150 to 300, drunk or intoxicated. So with this background of knowledge, if we move back to our question, what do we see? That the correct answer in this situation would be option B, right? Consumed alcohol and under the influence, because the blood alcohol percentage is 140 milligram percent. 140 milligram percent, right? Let's move to the next question. Right. So our next question is, the active principle of the plant poison shown is. So there is a photograph which has been given, and a very simple question has been asked: what is the active principle? See, there are variety of plants which are intoxicants, and time and again certain questions have been asked. So I have chosen this plant because it's a very important cardiac poison. The plant is called as Cerbera thivetia. The plant is called as, also in Hindi it is called as Pila Kaner. Pila Kaner. And the active principle that this plant contains is thivatin. Okay, you can very simply recognize this plant, um, as this plant is commonly seen in a lot of parks and all, having yellow flowers, and leaves are very cylindrical, lanceolate kind of an appearance. Cerbera thivetia, cardiac poison, right? Let's take this opportunity to talk about uh, three very important seeds also, which have their own medical legal importance, and they have been asked in the examination. The first seed is seed of Nux vomica. You should be able to, remember the photographic appearance of the seed Nux vomica. It's a spinal poison, right? And the chief feature of its intoxication is convulsions. And during the convulsions of this spinal poison, which has active principle as strychnine, the active principle is strychnine, and the chief feature is convulsion. And during convulsions, people tend to have different kind of postures. Okay, the important postures are opisthotonus, pluristhotonus, and amprosthotonus. So during convulsions, these are the postures that can be attained by people under the intoxication of nux vomica, and the most common posture seen is opisthotonus. The fatal dose of this plant is one crushed seed, right? The second seed in the bottom that you see are seeds of Phemicarpus anacardium, also known as marking nut, also known as marking nut. The medical legal importance of this seed is that it has been used for production of artificial brews, used for production of artificial brews. Okay, and the active principle this seed contains is bilavanol, or semicarpol or bilavanol. Okay, the third seed in the picture is seed of Abrus precatorius, and the active principle this seed contains is Abrin. The medical legal importance of abrin is it acts like a viper poison in the body. Fibrin acts like a viper poison in the body, and thus in olden times, Abrus precatorius was used for production of a weapon called as sui. Okay, so these qualities of these three seeds have often been used for production of questions in previous examination. Let's move to our next question. The next question is a 32-year-old male goes to a party. He consumes some stuff there after which he becomes restless. So there is history of restlessness that has been given. He develops perspiration and chest pain. He is brought to the emergency where it is noted that he has increased respiratory rate and his body temperature is 103 degrees. So there is increased body temperature, hypothermia. Okay, and the person shows a violent behavior. What is the causative agent? Okay, now consider a person who is uh, a young adult. He goes to a party, consumes something, suddenly develops perspiration, chest pain, right, with increased body temperature. The answer is very, very simple, right? The answer is cocaine. The answer is cocaine. For cocaine, remember few important uh, things. Number one, MI, myocardial infarction, like presentation, that is cardiac ischemia. Second, increased blood pressure, okay, and increased body temperature, also known as cocaine fever, also known as cocaine fever, right? This question around cocaine again is very commonly asked in the examination. I mean, there are certain more products of recreation. There could be cocaine, there could be opium, there could be cannabis intoxication or cannabis product. Then we have methamphetamines or amphetamines and LSD also. But majority of the time, the question that comes to us is more or less around the intoxication of cocaine. So, as a student, when we are doing that question, there are few very important things that we need to remember. That if the examiner wants to give you a question around cocaine, there would be few specific symptoms which should be highlighted in the question. One is myocardial infarction, like symptoms or presentation like chest pain, sudden perspiration, cocaine fever, increased body temperature, right, and increased blood pressure. So if you have these kind of findings, go in favor of cocaine, right? Let's take our next question. Next question is, a person experiences a sudden sharp pain in on his foot, uh, as if something has bitten his leg. He reaches hospital where a swelling with erythema is noted. So we have finding of swelling with erythema on his right foot. with a puncture hole in between. So we have a single puncture hole in between erythema. So it should be something like this: a single puncture hole, and all around there should be swelling and erythema like this. Okay. He has difficulty in breathing. On investigation, his blood picture is within the normal limit. What is the causative agent? So when you read this kind of a question, again, similar kind of questions also come in examination. Uh, Reading these kind of questions should trigger your mind to think around snake bite or a scorpion bite, right? Now, what is the difference between a snake bite versus a scorpion bite? The difference is in the puncture mark. Snake bite shall have two fang marks on the body, whereas scorpion bite has one puncture. All other presentations can be similar. Snake bite, depending upon whether it is hemotoxic or neurotoxic, can have minimal or more erythema around the puncture marks. Again, if it is a hemotoxic snake bite, the blood, investigations would be altered. The symptoms would be of profuse bleeding or excessive bleeding with clotting factor defects, right? If it is a neurotoxic snake bite, the symptoms would be of neurotoxicity, difficulty in respiration, diplopia, or any other neurotoxic features. So, in the question, there are no neurotoxic features given, there is no excessive bleeding, and the puncture mark is only one, which means snake bites are ruled out. So, it should not be a case of Russell's viper, it should not be a case of crate, right? Single puncture mark comes with scorpion. So it's a case of scorpion bite, and in this situation, people have excessive release of catecholamines from adrenal. Adrenergic storm. Remember, so if you find increased BP, increased pain, increased respiratory rate, adrenergic storm happening in the body, typically happens with scorpion bite. Okay, let's move to our next question. The next question is from the section of forensic psychiatry. It says that an insane person is hospitalized. In hospital room, whenever the nurse comes to attend him, he starts shouting violently and keep referring her as a ghost. What is he suffering from? Right. So what do we see in this question is that a person is insane, he is hospitalized, and whenever he sees the nurse, he refers her as a ghost. His referral of somebody being called as ghost only happens when he sees the nurse, which means he has a body. When he sees that body, then he says or shouts that a ghost has arrived, and this feature is called as illusion. This feature is called as illusion. This is not delusion of persecution, because delusions are false beliefs. He is not having a false belief, he is having a stimulus, right? Visual hallucinations are again, he sees something when there is nothing there. So in hallucination, there is no stimulus, but in illusion, there is wrong interpretation of a stimulus. So in this question, a stimulus is present, that is the nurse herself, and so the answer is illusion, right? Okay, with that, we come to the end of discussion of few questions from this segment also, and this ends the part 3 of our series. I just hope that discussion of these questions help you in your examination, and you all do fairly and wonderfully in your examination. Best wishes, best of luck. Bye bye from my side.